So how it works is basically it increases your body's ability to produce insulin, which comes from your pancreas, and it also delays stomach emptying, so you feel fuller longer.
Welcome to the Ultra Healthy Now podcast, where your journey to feeling younger, sexier, and more energized begins. Dr. Nicole Srednicki, who specializes in high-performance health, will dive into practical, actionable tips and strategies that can transform your physical, mental, and emotional well-being. Join us as we uncover the secrets to living a healthier, happier life, mind, body, and spirit. Because true health, beauty, and happiness start on the inside.
Hello, and like the intro says, this show is all about feeling sexy, young, energized. And one thing we're hearing that is a magic little shot for everybody are these wonder drugs that have come into the market, like Ozempic, Wegovy, Semaglutide, and the list goes on, right? But we all want to know what's the real story behind this. Is it actually good for you? What is it doing to your body? The pros, the cons. And that's why we have Dr. Nicole Srednicki today to shed light on all of these mysterious, apparently magical shots, right? That we can just give our body and look and feel fabulous. But is that actually the truth, right? So welcome to Ultra Healthy Human Now, part of the Rich Dad Network. I'm your host, Alexandra Gonzalez-Ganoza. And we're going to be diving into this topic. So, Nicole, are these safe? Are they hurting us? What are the pros and cons? Give us a little background before we jump into everything.
Yeah, so this new wonder drug that seems to be very new and awesome. But the thing I always say is there's always a yang to a yin, right? Everything always has to balance. So, interestingly, a few weeks ago, I've never watched the show South Park, but my husband was like, you have to watch this episode of South Park. And I was like, what? And he's like, yeah, it's on Ozempic. And I was like, oh my God. So it was my first episode of South Park. Alex, have you ever watched South Park?
No, never. That's so funny.
Okay, this could be the first episode because I have to say I laughed so hard because there were definitely some truth to it. Big pharma and people's insanity to get their hands on this. It's always kind of bits of crass, but it's funny. It's kind of worth watching because when you really reflect, you're like, wow, some of that is very true. So
yeah.
I give it to the writers of that show. It was a great episode.
That's so funny.
Anyway,
that's so on brand with your husband, Mo, because I know him personally. It's like so on brand, and I love that. They're tying in because I think it's like satire, that show, right? So it's like tying in with the reality of what you said. People are going crazy to get their hands on this drug, right? So that's, I don't know. It could be good. It could be bad. We'll find out.
Yes. So if you don't know what this is that we're talking about, it's a new class of drugs, and they're known as GLP-1s. And originally, they were developed for diabetic patients to help with their blood sugars, but they found there was a secondary effect for weight loss. And so how it works is basically it increases your body's ability to produce insulin, which comes from your pancreas, and it also delays stomach emptying, so you feel fuller longer. And what the cool part, when you say it increases the production of insulin, the cool thing and what's more innovative about some of these newer diabetic drugs is they have the ability to know when you have eaten. And that's when it will cause your body to produce more insulin. If you look at old diabetic drugs, the reason people weren't taking them like crazy was because unless you eat something, it'll still just shoot out insulin. And so then they can be very dangerous. But in this case, basically like people can kind of not eat, still take this, but when they do eat, they can overeat, and then their body knows to send out the insulin. And so now people have started to kind of abuse this for weight loss. Now, there's always like sometimes there are a lot of health risk factors if you are obese or have blood sugar issues, right? So there are certain situations where this could be life-changing for them. I've had tons of inquiries about these weight loss injectables, and I've done a lot of research, and most importantly, keeping up to date on every single day what is the newest thing coming out, because it's new. And it's important to remember that, with a new medication, we don't know long-term outcomes. Therefore, we should always be cautious. For example, remember, this is like way before, this is even before my time, almost. There was a drug back in the day called fen-phen. This was a weight loss drug that came super popular in the 90s. It was actually two drugs put together. One of the drugs had been around since the 70s, the other from the 50s. Well, in the 90s, they decided to combine them, which is why it was called fen-phen. This drug turned out to have long-term horrible outcomes that even caused death, because they were causing people to have heart failure, heart valve disease, high pressures in their lungs, called pulmonary hypertension, that literally, like, hypertension is one of the worst diseases. You literally feel like you can't breathe. Anyways, this drug was pulled from the market in 1997. So that means it was on the market. People were, loving this weight loss drug for 7 years before they realized how dangerous it was. So this is like, I want people to wake up and realize this is like, of course, it's a wonder drug, but we don't know what's going to happen down the road. So,
Okay. And Nicole, quick question. Sorry, but because this popped into my mind. So when you're comparing this, for example, to like fen-phen, would you consider it, from what you've seen? Well, one, how long has this been out in the market? Because they market it as new, but I feel like it's been there for some time. And two, would you say that the cons are just like fen-phen? Because I know people say, pancreatic cancer, or like the dead gastrointestinal syndrome or something like that, like a dead bowel, that they've been seeing, like, hospital visits because of this. So in comparison to what you've seen in the market before, because I know you specifically at the clinic concentrate on cutting edge medicine, and you use all these tools, but always when you see that the pros outweigh the cons.
Yeah. So, I mean, this works much different than fen-phen. I know with those drugs, they did a lot with like speeding up heart rate, and they were completely different. This is specific to working in your pancreas. And that's why, we're going to see a transition in the type of symptoms. But again, kind of to what you're saying, as far as what we're seeing hospitalizations for, some of it I think is true side effects. I think some of it is from abuse. If you're using this, this decreases your appetite. People aren't eating and going to these extreme measures. Your bowels have nothing to empty out. Your bowels are naturally going to slow down, right? So that's kind of like just an example of like the awareness around it, and knowing, what you're taking, how much, are you on a proper diet along with it? So, if you're one of the people that just wants to lose a few pounds, there are so many other things you can try that are more sustainable and safer. So when my patients don't have like an obvious amount of weight to lose, or, risks of diabetes or like the blood sugar abnormalities, I always suggest starting with the ultra healthy 21-day detox. I know I always talk about this, but it's such a great reset. This allows you a structured and safer way to reset your body. Take Christy, for example. She's a 44-year-old patient that said, ever since giving birth, she's had difficulty losing weight. And her goal was to lose like 10 pounds, right? So you look at her, she's not obese. And but she wants to like improve the way she looks. And I think a lot of women can relate to this after they've had kids, hormone changes. It's more difficult to lose weight. So, she said she tried everything: diets, exercise, intermittent fasting. And I said, have you worked on getting rid of toxins and inflammation in your body? And she said, no. So that's when I suggested doing the 21-day detox to her. And she said, can I just go on one of those, new medications and just inject myself? Yeah. And, I suggested that we try something a little bit safer first, since we don't know, the long-term outcomes, right? She has this newborn baby. Why would you want to do anything to mess up your health when you have this other life to take care of besides yours, she agreed that would be the safer route. And so she proceeded with doing the 21-day detox. And so at the end of it, we had our follow-up visit to discuss the progress and post detox and reevaluate, would we need one of these types of injections to help her? She was thrilled when she walked through the door. She said she lost 7 pounds and she was feeling much lighter. Her clothes were fitting better. Her skin was glowing and she said she had more energy. And so she said, thank you so much for suggesting this, because instead of giving into a medication, she was able to take on this herself and lose that weight. So she lost 7 pounds in 21 days. And if we compare this to a semaglutide study, the average is you can lose about 4.4 pounds in 30 days on average, or 2% body weight. Now, when we compare this to Christy's results, she weighed 145 pounds. She lost about 7 pounds. So she lost 7.25% of her body weight. So this was more effective, this was safer, and it was empowering. The additional benefits of boosting her metabolism, reducing inflammation, getting rid of toxins. She won by choosing natural over a prescription.
And that's what I love, Nicole, because you want to attempt the natural route first and then resort to medication if needed. Because I will say, obviously there's certain situations where I see both extremes taking it. The people who actually need it, who are diabetic, the people who are, very overweight, who in that situation, I think you would say outweigh the pros and cons. Obviously being overweight too contributes to so many health issues and just deteriorates, your overall life. And then the person, which, I don't discredit any situation, because I think every situation is difficult in its own way. Like for example, losing those stubborn 10 pounds, it's really hard. It's a lot easier to lose, 30 pounds when you're overweight. When you're those 10 pounds, I've been there, you've helped me with it. It's so difficult, right? Because it's like your body, it's a little bit of weight that you need to shed off. And so I think one, it's really important to highlight the difference between who needs to take it. Then number two, like you said, highlight, can you go the natural way? Have you even tried it? And then, I do want to ask you one thing, because I see people who go on the semaglutide and get amazing results, but then they gain it all back. And I want to ask you why that happens. And then number two, does that happen with a detox? Because for our entrepreneurs and investors listening, it is so important. I know personally, when I feel good, when I look good, I feel good, I do good, I'm more productive, my business does better, because you feel more confident in yourself. And I think that's why when we're talking about weight, it's not just weight, it's mentally, right? What does it do to you? And so to be able to talk on stage, go on this podcast, you need to feel good, you need to look good. Like, it really does determine your behavior that day and what decisions you make. So talk a little bit about that, and then how to keep the weight off.
Yeah, definitely. So like with Christy, for example, after she had her great results, having that support system, right? So we had a meeting to discuss now, how do you sustain this so you don't revert back to old habits? And because she went through that process, she no longer was craving sugar, right? And so we want to sustain that. We want to keep it that way. So we talked about not, don't reintroduce just because that 21 days is over. Don't go back to old habits. Since you're not craving it, don't even entertain it, right? Try to keep it out of your house. Don't start adding, creamers back into your coffee, snacking, adding. So a lot of people will go back to thinking the fake sugars are okay to use, but then that also brings along like the sugar cravings. We also then decided for her, she was going to continue the weight loss support supplement, because there's botanicals in there that actually help with like sugar aversion, help with boosting the metabolism a little bit. So now she's on like a healthy maintenance. And so for her, that was a good way to sustain. Now let's talk about Ellen. She's another patient. Now she was obese and she was able to lose 18 pounds in 21 days on the detox. And she sustained this for a couple months, but slowly, she lost like another, during that maintenance phase after, she lost like another 5 pounds, but then she hit a plateau and she said, she doesn't want to lose the momentum, because she had stayed, on this program and things were going well. But she said, is there anything we can implement? And since this was the case, right, she put in the effort, she was doing really well, but then she hit that plateau. And because also her blood sugars were a little bit, even though her blood sugars went way down during these changes in her eating habit, we decided that doing maybe a baby dose of semaglutide would be helpful for her to kind of like kickstart things again. And one of the reasons I would prefer semaglutide in this case over some of those prescriptions like Ozempic or Wegovy is that you can choose the dose. Like, so we could start her on such a small dose versus if you get these standard injections like Ozempic, it's like an auto injector. So you're not allowed to really adjust. The starting dose is already pretty high on it. So, the way I look at it is the lower the dose, the less side effects and the less potential risks you'll have. The other thing with compounding, semaglutide or tirzepatide, some of these, they compound them with B12 that can reduce risks of nausea. Some of them, they add glycine, which can help prevent muscle breakdown. But people shouldn't be abusing them that much that they're having muscle breakdown. But many of you are probably hearing about now these side effects that come along with these medications. Commonly, we see nausea, acid reflux or GERD, constipation, sometimes stomach upsets. And the higher the dose, the more likely you are to experience this. So with Ellen, we started her on like a micro dose and worked it up to a baby dose, still being much lower than these injectables, but it was enough that it was working for her. It was decreasing her appetite, helping her get over that plateau. And so the next step is monitoring, super important, monitoring pancreatic enzymes because this works in your pancreas is very, very important. I'm not really seeing this done. I don't really see it out even in the recommendations yet, but from day one, when this, came out, I think it's been out. You asked me earlier, when did it actually come out? Yeah. I think we started seeing a lot of it on the market about a year and a half ago, with the compounded. And then we started seeing some of these medications out. So it's been out for, it's still in drug world. That's a short amount of time. Long-term outcomes. But, from day one, I thought it was important. Let's monitor these people's pancreatic enzymes like every 6 weeks, because that's part of the process. When people go to the hospital with pancreatitis, guess what? Those enzymes are through the roof. If they had been monitoring them, they probably could have caught it a lot sooner and maybe mitigated these risks. Bowel movements, sorry.
No, and just one thing I want to highlight there too is that before you continue on the list, and this can be a topic we touch on once you complete that, but it's so important because I see, for example, influencers that are promoting their med spa, and like the med spa sends like the package and people just self-administer without even knowing about the drug and don't have someone like you that is checking their blood, their pancreas, their enzymes, all these things. So I also want to highlight the importance and to your knowledge, is it safe once you're done with like the description? Because I'm actually intrigued into all these side effects. But, are we supposed to be taking these for med spas, or should we go to someone like you that's actually going to be concerned about our health and not just the weight loss?
Yeah. So I'm glad you brought that up. So I'll finish talking about the side effects and stuff. And then I'm going to kind of go into talking to the abuse with this. And I actually have a specific patient. She actually came into me earlier this week that came to me from a med spa, and I'll talk about what happened with her. Okay. So back to monitoring, bowel movements. Are you going daily? If you're not, they need to be taking something to stimulate. Like in my patients, I'll have them use the colon detox, which is like natural botanicals to help stimulate bowel movements, but also assessing, are you being healthy? Are you even eating enough so that you will have bowel movements? Are you having reflux? Sometimes that's like that kind of burning sensation, or sometimes you wake up with it, and you may need to take a supplement for that, or something like Prilosec to reduce that acid production. But again, it's not a good thing. Is this just going to be temporary, right? We don't want to say, okay, we'll just take meds forever. And then other, just paying attention. Are you experiencing other side effects? What's your energy level? If you're having a lot of side effects, this probably isn't a good fit for you. reevaluate and consider alternatives to the injectables. Of course, there's already like black box warnings. So, if people have certain medical conditions, they should automatically be excluded. And that's something you could talk about with your doctor. If you're on it and you're having stomach pain, you most likely should stop it immediately and contact your doctor, because these can be signs of worsening issues. For Ellen, we've been doing great. All of the above. She's not having any of those issues. Her pancreatic enzymes are staying within range and she's progressing. And we have an exit strategy. So the strategy is to get her close to her goal weight. We're able to then reduce the risks of diabetes, help her with that extra weight loss, learn new eating patterns, and then discontinue the semaglutide, right? So that's something. Sorry.
No, and that's like huge because at least personally for me, I know, we're talking about, whether you should take it or not. Are you a good candidate? And personally, honestly, like the detox, it taught me how to eat, right? It teaches you how to keep the weight off. And so I think that's the reason why I've been successful in my journey also, because I learned healthy habits. I have less inflammatory, signs in our side effects. And it's so important to just learn those eating habits that are going to set you up for success in the future, not just rely on something that's, I don't know, not going to make you hungry for a while. I know that there's a time and place for it, but maybe starting off with something like the detox that instills these habits in your life for, the 21 days. And then you actually learn to what your body needs and how to feed it. Because sometimes I see like these videos of people saying like, oh, I can't eat this on like semaglutide because it makes me nauseous. And it's like, funny, that's how I feel when I get off the detox. Like everything that's processed tastes like chemicals to me, right? So it's kind of like it's like a natural way of Ozempic in a way.
Yeah, yeah. And I mean, all of these things are coming to mind. I had a patient a few weeks ago that she came to me and she's like, oh, I went because she was traveling. I stopped at this clinic. I've been on this tirzepatide now. It's so great. I can eat whatever I want and I don't exercise anymore. Like, does that really like resonate? Like, does that feel good in your soul when you're saying that? Like, that is not healthy. That I would consider abuse, right? And the fact that, shame on the doctors if they didn't give you any of that education, when they're just, misleading you and saying, here's the wonder drug, everything's cool. That is a disservice to you. You need to be creating new habits. If you're on this, use it as a tool to get you where you need to be and then get off of it so that, lower these risks. So
Yeah.
I'll move into abuse now.
Yeah. No, but I do want to ask you, and this might, lead up to the abuse too, is there a certain requirement for like a BMI minimum in order to be able to be prescribed this, the semaglutide?
These keep changing. So originally they would only give it for diabetics. Then if you were high risk of becoming diabetic, then they added in the weight loss components. Now, because there are, the patients that are true diabetics are having trouble sometimes getting it. Some of the insurance companies have actually pulled back and they won't let you use it for obesity. So it's really depends kind of like what insurance you have. And then, and that's why it's the compounded version has, in a lot of these weight loss clinics has popped up in a lot of places because then it's, basically anybody can get their hands on it.
Yeah. And okay, so you want to talk about the people who are abusing it.
Yeah. So, I'm seeing a lot of these clinics that are offering, the weight loss. I mean, I probably can't say companies on here, but old school traditional weight loss companies are now like, just come in for your injections. Tirzepatide, I think, is one of the newest ones. And, when I was going to tell you about the story, I had a patient come in earlier this week. And she's like, oh, I just can't lose these last few pounds. And we're talking and she's like, I've been going to this weight loss clinic and I'm on tirzepatide at, the max dose. And I said, well, we kind of talked through a few things. She's never had her pancreatic enzymes checked. They didn't talk to her about, I said, what are you eating? Can we maybe lower the dose and work on some lifestyle habits? And she's like, well, I haven't been. And then I said, well, we could switch you maybe to semaglutide. And she was like, oh, well, that's why they switched me to tirzepatide. I already maxed out on semaglutide. Right. So, I mean, I felt so bad for this lady. She's lost a lot of weight, but now she's maxing out and she's starting to build a resistance, and she hasn't changed her eating habits or started exercising. Like, that's going to be a disaster. And so, I had a long talk with her about, we got to hardcore, we got to restructure things, and we got to change the eating habits, and we need to check your labs right now. Who knows what's going on? She's constipated, all of these things. And it's scary. And then, as you've already kind of touched on, like hospitalizations, right, with these crazy high doses that people are taking, we're at any level, maybe if it's even a lower dose and there's no monitoring going on, we're seeing emergency room visits go up. We're seeing, pancreatitis.
Because of this drug?
Yeah.
Okay.
And this can be deadly. I mean, and without your pancreas, like, you're going to be on injectable insulin the rest of your life. So if you need to, get your pancreas removed, if it, your pancreas only produces a certain amount of insulin, that's why sometimes type 2 diabetics turn into type 1, which is where you have to walk around with a little pack that's constantly dispensing insulin. That does not sound fun. That is a reality, and people need to be awake and understand that, right? So stop abusing this. Sorry.
No, okay. So obviously, there's all these scary things like the dead bowel, the pancreas, all these things that could go wrong. Abusing it, eating your own muscle. But then, also in your world, how would you say, what are the pros? Because I also saw this study that apparently, and I don't know if this is true, that it can also decrease or delay Alzheimer's by 18%. There's all these great things that are being attributed to this drug as well.
Absolutely. So, we've seen a lot of good studies, seeing the decreased risks of dementia, sleep apnea, heart disease, cholesterol. We've seen improved kidney function, just to name a few. But in short, guess what all these lead back to? Low sugar intake.
Mm-hmm.
It's not the drug reversing diabetes. It's because people are lowering their sugar. We've known for years that sugar will cause heart disease. Being overweight will cause heart disease. It will cause dementia. It will cause Alzheimer's. It causes sleep apnea because when you're obese, you have more weight around your neck and then you can't breathe. I mean, these are all kidney function. Sugar kills your kidneys, literally. So that's, some people hang their hat on that too, but it's about what's going in your mouth.
Yeah. And even there, and even there, Nicole, it's and that's an important emphasis too, because it's okay, we know that a lot of sugary foods, cookies, whatever, America in general has a bunch of additives into their food, right? And this is intentional. It's purposeful. Why? Because we're addicted. We consume more. We know it, right? Big pharma, etc. So this creates an addiction in our body, right? That's why when we go on the detox, like what you have, we have withdrawals. And I can see why someone who's overweight, who's so used to having these into their habits, consuming this food, it might be difficult, and they might need that shot to just close their mouth, look the other way, and not eat what is poison to their body, and eat their salad and their vegetables instead. So in that situation, like you mentioned, I think it was, Chrissy or
yeah, Ellen was the one that we put her on it.
Okay. So in that situation, I'm assuming it would be in her best interest, because then it's also okay, well, choose your poison. Do you want to take the risks of those Ozempic if you can't do it naturally, which I know can be in some case, or would you rather, keep consuming all this sugar and processed stuff?
Right. And that's why, as a doctor, it's my job to sit down with you and weigh out the risks versus benefits. So in some cases, like Ellen's case, when she is obese and has a risk of diabetes, it is warranted that, even though there's some risks and we don't know long-term side effects, going on this temporarily to help reduce the risks of developing diabetes, dementia, all of these things, inflammation or body, heart disease. Okay, going on it, we came to that agreement. Cool. Let's get you there on the lowest dose possible and for the shortest time period while you're implementing these other
Like
Uh,
creating a plan of success with or without the injection. What's life after the injection look like? After you're done losing that weight, what does that look like? And what does your present need to reflect right now in order to achieve that? Like sustainable, happy results where you're happy with yourself and you're happy with the decisions you make. And we've talked about the pros, the cons. I don't even think we talked about how this drug actually works, why people are losing weight from it, how does it lower your insulin, your sugar, why people don't crave certain foods anymore. Can you talk a little bit about that? What goes on internally?
Yeah, so it shuts off a hormone that makes you actually kind of feel hungry. And it works in multiple ways. When you do eat, it releases insulin, and that's why you're not gaining the weight, but it also slows the absorption of the food in your stomach, so you feel fuller longer. So that's why people tend to, eat less and eat less frequently. So yeah, that's kind of like how it works. There's also, I think, something to be aware of. Even if no matter what you get the prescription one, you get the compounded, some of these are kind of expensive. And we are also starting to see fake ones on the market, which we have no clue what can happen. There's like oral versions of it, which I'm sure there will be prescriptions down the road for it, but a lot of this stuff is not validated yet. There's mouth sprays, semaglutide mouth spray. So all different things on the market. So, being aware of,
It's
what
so
are you taking something reputable?
it's so devastating and so sad to me that people will literally hurt other people just for money. Because obviously that's what we see in the industry overall, but like to take advantage of someone's like weaknesses or fears or just like insecurities and feed them like poison or something fake without them knowing. That's why it's so important to be educated. It's sad, right? Because we do have to be aware of that. And that's why I'm always so thankful that I have you to go to you for all my supplements and everything, and know that there's not junk in these supplements or whatever I'm consuming or medications. So again, do your research on who you're going to. Go to someone you trust, right? And then now that you were talking about, I'm just curious. For example, when you say like, okay, you start to feel fuller on the medication, I know personally, I know a lot of people probably go through this too, that like sometimes I'm mindlessly eating and then next thing you know, I'm like absurdly full. And I'm like, oh my God, why did I just do that to my body? Right? Like I'm on my date night with Roberto and we're eating, we're enjoying like wine and pizza and because he's Italian, right? And so I get to the point where I'm like, oh no, I'm feeling awful. I should not have ate that much, right? Um, does Ozempic prevent that from happening? And I want to take advantage of this moment too to pick your mind. What's a way of avoiding that happening in the first place, for example, to someone like me?
Yeah, so that comes down to mindful eating, which I think where I've done the same thing. You're out having a good time, you're living in the moment, but being mindful of each bite, you're putting in your mouth, eating slow and paying attention to when you don't people like you want to think about when do I actually feel full? You need to define that for yourself. Do I feel full when my gut is like feels like it's filled to the seams, or am I not hungry anymore? And that's something you should kind of like familiarize yourself with your own body, that like internal dialogue, and just be mindful of it. So that's probably the best way. It's something we're all culprit of. Don't eat in front of the TV. Don't eat because you're eating, not because like you're doing something, multitasking, because that's when people always like overeat.
Yeah. We should do a show on that too, like mindful eating, binge eating, like because I know so many people suffer with it and there's so many health consequences, especially for entrepreneurs. Like we're so stressed, we get home and we're like, let me just eat this whole bag of popcorn and then the 5 million things in my pantry, right? Like,
yeah. And
um,
I mean, I think too, kind of on that note, talking about like emotion, right? Emotional eating when we're
yeah,
stressed, we eat all of this, and just kind of our whole looking within yourself, right? Body image. I've had friends that do not need to lose weight, but they fixated on looking like somebody on Instagram, and they'll go on this medication, and then they look emaciated. Like girls should also realize like what healthy is and what is not. Like when you are too skinny, it will age you. You will look old, and you need to have like, that's part of self-esteem, like getting comfortable with your body. And don't, just because you can easily get this, this semaglutide, these peptides all over the place, but you have one body. Don't abuse it.
Yeah. And nothing gives you the confidence. I will say, like, obviously you can take the shot, lose weight. And even then, so many people that just keep on losing weight because it's like you get addicted to it, almost like what I heard that happens to like Botox and things like that, where it's like nothing compares to having the self-confidence in yourself when you made the hard decisions, when you woke up, you went to the gym, you ate healthy, you nourish your body because you love it, and you treat yourself with self-respect. That's what gives you confidence. Because how many amazing people, beautiful women do we know, and men, because I know men are also on this, that are still insecure no matter how good they look, right? So it's all about the habits that you do when no one's looking. One thing too, you mentioned that the medication, a certain hormone, it acknowledge, like the hormone that can acknowledge whether you're hungry or not, and it like decreases it. What is that hormone called? And is there like a natural, like people are saying nature's Ozempic? Like, is there a natural way to mimic the effects that semaglutide would have on your body? A pill?
So yeah, some of these hormones, it works in several different hormones. One of them is leptin, which is like your hunger hormone. And then the signal that actually goes to your brain to shut off like that hunger area. And then when we look at like natural Ozempic, I think they're saying like berberine and some of the supplements. There are some, so like I know I have like a blood sugar supplement, Ultra Sugar Guard, that can kind of help. It's similar in that it does have berberine, has gynema, which helps to, it's like sugar aversion. So it helps to kind of shut off that sugar craving, and things to help with inflammation in your body. And when your body's in more of like a natural state, it's gonna, it's sometimes not then triggering some of those emotions that or hormones that, stress hormones, things like that cause you to eat more. So, yes, berberine has been shown to help sometimes with some of this, but I do like gynema and some of the, I think in like our weight loss supplement that's in the Detox, there's
Sounds amazing.
Botanical. Thank you. There's some botanicals in there that can kind of help with boosting the metabolism and, yeah. So, weighing out, always like weighing out your risk versus benefits, with these medications, trying something first before turning to it, like the 21-day detox, modifying some of your lifestyle habits, and just make sure, you work with a doctor that can offer alternatives. If together you decide that these medications are for you, then make your plan, get on the right dose that works for you, the smallest amount that works for you. Make sure you're being monitored and set an end goal for discontinuing the medication. So, my few take homes about this, it's important to remember that it's a new medication. We don't know the long-term outcomes. Is it a weight issue or is it an inflammation and toxin issue? And then, using the lowest dose, because then there's going to be less side effects and risk. And just remember, you've been gifted with a body. Don't abuse it. Look at, your gratitude and really, do I need to take a prescription for this?
Yeah. And, for all the entrepreneurs and investors listening, I know weight loss can be important to feel your best, to look your best. And sometimes it can be tempting to look at, the trending drugs on the market and go the easy route, right? But I know this audience is not like that. I know this audience likes, implementing those healthy habits. And it's extremely crucial to make sure you take the right approach that, can enhance your energy, your mental clarity, and that you're set up for long-term success, and avoid things that can, like Nicole said, hinder your one and only body, right? And so, I, for one, I'm a huge advocate for the detox, Nicole. For me, that's nature's Ozempic. Yeah.
I love that. And actually, I just thought of Robert Kiyosaki is one of my testimonials. He lost all his weight before this stuff was even on the market. So look at him as he used to be a little non-compliant, but when he saw the benefits and dedicated himself to making the change and dropping that weight, it helped him in so many ways. And then it was easier for him to be compliant and live a healthy life without having to turn to that medication.
Yeah. And your detox is just so unlike anything else I've seen in the market, because those habits stay with you. Like you said, even after, going off the detox in your maintenance phase, whatever, you keep losing weight. You don't want those toxins anymore in your body. The effects actually last. And so it's so important to implement that into your body. And Nicole, for people wondering, are they right fit for semaglutide? If they want it, if they should instead try the detox, where can they find your supplements? I know you mentioned the weight loss supplement, or even the colon one. So where can they find you and book an appointment with you or find your supplements?
Yeah, they can go to ultrahealthyhuman.com. The detox is available there, or if they want to have a consultation and go through get blood work and work on a structured weight loss program.
Yeah. Well, thank you so much, Dr. Nicole Srednicki, for shedding light on these trending, magical shots, and for, telling us the truth, because I know Dr. Nicole Srednicki cares about every single person, not only her patients, but just people she doesn't even know yet and their health. That's why she does what she does. And so I'm so grateful to have a show like this where we can shed up light on, the pros and cons and what is it healthy for you. So thank you, Dr. Nicole.
Thanks, Alex.
All right. And we'll see you guys all in another episode. Comment below if you want any shows on, we talked about binge eating. We talked about all these other different topics. So comment below if you, what kind of topics you want to see in the next episode for all entrepreneurs and investors. Super important to take care of our health, and subscribe to the Rich Dad Network. Thank you, guys.
Thank you for tuning in to the Ultra Healthy Now podcast with Dr. Nicole Srednicki. To discover more, visit ultrahealthynow.com and jumpstart your wellness journey with our 21-day detox program, a total body reset, more energy, better focus, and weight reduction. Our carefully formulated, high-quality supplements will aid in a new level of wellness. Don't wait. Unleash the Ultra Healthy Human within you. At Ultra Healthy Human, Eastern and Western modalities are combined with cutting-edge technology to guide personalized health programs to help you tap into the limitless potential of your mind and body. Because true health, beauty, and happiness start from within. Remember to subscribe, like, and share this episode wherever you listen to podcasts.
And before we sign off, I want to make it crystal clear that the information presented here is for informational and entertainment purposes only. This episode should not be considered a substitute for professional medical advice, diagnosis, or treatment. And while we strive to provide accurate and up-to-date information, the content discussed in this podcast is based on general knowledge and research available at the time of recording. Medical knowledge and guidelines can evolve, and what we discussed may not always reflect the most current research or recommendations. If you have specific health concerns or questions, we strongly encourage you to consult with a qualified healthcare professional or medical specialist who can provide personalized advice tailored to your unique circumstances. Every individual's health situation is unique, and what works for one person may not be suitable for another.
This podcast is a presentation of the Rich Dad Media Network.